Nothing on the Bunnell Foundation's Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bunnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast, sponsored by Vertex Pharmaceutical. Here's your host, Laura Bunnell.
We're traveling to Turkey today to meet the founder and CEO of the Middle East CF Association, Christine Noke. She is an American making a difference in the Middle East. She's raising awareness about cystic fibrosis. I heard about the organization through Dr. Samia Nasser at the University of Michigan and from a father in Egypt who has twins with the disease. He said the conference was a wealth of information and it gave him hope that he desperately needed. Noke works on behalf of that father and with the medical and scientific communities, along with members of the Middle East CF Association. Christine, why don't you tell me why and how you organized the Middle Eastern CF Association?
Okay, I'm the former director for CF Worldwide, and I retired from CFW in 2012. My intention at that time was to step back from working in the CF community. I'd been working in developing worlds with the CF Worldwide for 14 years, and it became really mentally and physically exhausting. So I decided I would step back. While I was managing CF Worldwide, I was positioned in Turkey to make it easier for me to reach countries we were working with at the time. And there was a lot of focus on India, Turkey, and the Balkans, so it made it really easy to be positioned here. I eventually applied for my residency here in Turkey. I loved it, and I knew I wanted to stay. I was lucky and married a lovely Turkish man and made Izmir my permanent home. Working here, I connected with the CF community in this region, and it was really those connections who inspired me to set up a regional CF organization. Despite stepping down from working in the CF community, clinicians, families, and especially the patients continued to contact me through social media, sending me emails, and really it was Facebook. They seemed to be able to find me very easily. And it was really hard to sit on 14 years of experience and do nothing when I knew that the patients were suffering and that there was a lot I could probably do to help. So I would say it grew organically out of need. And we're still growing, changing, and adapting through our pilot programs. We focus in 3 key areas of activity: getting diagnostics to the hospitals in the region, training CF teams and supporting CF centers, and advocating on behalf of patients for access to essential therapies.
Was it overwhelming to start this to help a community with cystic fibrosis that had nothing?
Well, I mean, I came into it with 14 years experience working with developing countries. So I'd really seen it all from India to us. We just went around Thailand. I just knew how bad things really were. So yeah, it's very overwhelming, and it's still overwhelming most days, especially on the days when I'm in direct contact with families or patients who are in dire situations. Through social media, our website, and emails, families reach out to us. They send us videos, pictures, and they share their stories. It's incredibly difficult to come that close to a family with patients who are near the end of life or suffering inhumanely because there are no drugs or clinicians to help them manage their disease in their country. We know we cannot help individual patients directly. The cost to fund medication or bring patients to other countries where there is adequate care is enormous. The cost of one patient's care would be more than training a CF team in a local hospital or, say, lobbying health ministries to provide access to essential drugs. Every day we have to make tough decisions, sometimes turning a family away, even though we know the patient is suffering and that there could be help if they could get care. But if we are going to change the lives of patients long-term in this region, we must get to the root of the problem, and that lies in educating clinicians, providing diagnostics, and opening access to essential therapies. In some countries, we refer to those as the low-hanging fruit, like Turkey. Programs can rapidly improve the lives of patients, but in others, where there is not one CF specialty drug or one clinician who takes an interest in CF, zero support from the government, these countries will be much slower progressing. We feel a constant sense of urgency to reach the patients who are most vulnerable. But so much of our progress depends on the country we're in, the clinicians, the health officials, and patients themselves. This is overwhelming when we come to the starting point. We ask where, how, what's the first step? We have a template of what we know may work, but each country is different and the solutions must adapt to those differences to be successful.
How many people, when you started this, were diagnosed in Turkey, and kind of how far have you come since starting MECFA, which is Middle Eastern CF Association?
My work in Turkey was actually with CF Worldwide for my previous position. MECFA has worked here in Turkey with Professor Nasser, which I'll tell you a little bit more about in this talk. But so when I first came here, 15 years ago in Turkey, they probably had 1,000 patients, 1,000, maybe 1,500 diagnosed, and the care was starting to develop, but they still were lacking many of the necessary drugs, and there were only a handful of clinicians. The work here was already underway, but it was being done by clinicians and a patient organization called KIFTR. So I wasn't really deeply involved with the development of CF in Turkey. But by the time MECFA was developed, and I developed it in collaboration with Dr. Bülent Karadag, who you will hear a lot about through my talk because he's my partner in crime with MECFA. He's really my strongest doctor in the region, and he's the vice president also of MECFA. He had done a lot of work, put down a lot of pavement to the road to care for these patients. So when we stepped in, we were just fine-tuning already a system that was there. And I remember one of the things Professor Nasser said, she'd gone to the Marmara University and met with the administration of the hospital to say, you need to increase the number of rooms and there needs to be separation and segregation and all this.
Let me just interject right here. So Dr. Samia Nasser, who you're talking about, is Egyptian, native to Egypt, and she is here at the University of Michigan Hospital as the clinic director for the pediatric pulmonology.
Yeah, she's head of the Mott CF Center director. So yeah, sorry. I always think everybody knows them because they're so everywhere, the doctors, MECFA is working in 3 streets. I know from my time before in CF Worldwide, what do you need in the developing world? What's happening? You said, how overwhelming was it? Well, I had seen some really bad things. I had held little children who were so blue, they looked like the Avatar babies in the movie. I mean, they were that blue. The mothers were tying them to the bed because when they moved, they coughed. And they were so ignorant to the fact that coughing was good that they just assumed the best thing to do would be to keep the child unmoving so that it didn't have to cough. I'd seen children who were 12 and 13 years old who looked like a 5-year-old with completely bloated bellies, spring arms from malnutrition. And they were the children who were getting enzymes. But the mothers were not educated enough to know that the enzyme comes with the meal, not an hour before the meal. So there were all these things that I'd already really seen that they are overlooked because it's like you have the answer in your hand and you just didn't tell her how to, give the medication right. And so the child is literally dying of starvation. So, I was ready for that. And I knew that what do you have to do? You have to figure out what's the most important things and the things that you can actually change, because there's a lot of stuff you will never change in many of the countries. You can't change the political situation. You can't change whether it's a social healthcare system or an insurance healthcare system, so there's always barriers that you never get over. But I knew that it's down to educating clinicians so that they know how to treat and care for the patients and to create CF teams. The allied health professionals are very important. You have to diagnose patients, and you need a diagnostic system that's affordable. I don't want to name names in this because we work with all industry, but some of the equipment that in the Middle East is very, very expensive. It can cost up to $200 a test. This is impossible in a developing country that has, sometimes maybe a $30 million budget for their healthcare for the entire nation of maybe 1 million or 1.5 million people. So you have to find solutions for diagnostics. And we did. We worked with a company here in Turkey, UTSAT. They produced a machine that's a copycat from the leading diagnostic systems. And it's less than a quarter of the cost. So the test dropped down to $17 a test.
Sweat test to diagnose CF.
Yes, sweat testing. So we went from the expensive equipment to this alternative equipment, which we are now working really hard to put these in all the hospitals, and not meaning to, but moving out the other more expensive equipment because it's not sustainable. It sits on a shelf, it collects dust because the hospital administration doesn't have enough money to buy the test kits, and it's not covered by the government. So it becomes obsolete, even though it's the best machine you can possibly have. So this was another area we knew we had to address because we knew there was lots of machines that were uncalibrated, no new kits, so they were wasted. So we targeted diagnostics, and we found that through UTSAT. We found a comparative machine that's very, very affordable for our countries. And it was also local. So that meant you had technical training available that was local, and it was the same culture and same thinking, same food, same. There's a lot of reasons why it worked out better to work in the region for our equipment. And then the final thing is advocating. There's no advocacy over here. People don't know what CF is. Doctors don't know what CF is. One of the big problems of not getting diagnosis is because they're not clinically seeing signs that should send them to a sweat test. They're treating malnutrition, they're treating lung function, but they're treating it as an individual case as it comes to the hospital. Patients literally walk around with their patient files under their arm. And they go to the government hospital and they give it to the pulmonologist, and he looks through it to see there's no CF team, there's no nurse, there's no routine, there's no physiotherapist that he works with. So, I mean, when you have this problem, you have to say, okay, what's the basics? It's educating the clinicians, it's getting diagnostics because we have to diagnose them. And that way we know what the numbers, and we can advocate the government to please cover the cost of essential drugs. And we created what we call a toolkit list at MECFA. It's just Dornase, vitamins, inhaled tobramycin, saline, hypertonic saline, a specific CF nebulizer like a Peri-Boy or a good solid CF nebulizer that will last several years, and nutritional supplements. So we created this list and we lobby the governments. We go in and we say, okay, here's some diagnostic machines that's going to go into all your hospitals, and we'll run an education program that educates your clinicians. And in return, you have to supply these drugs. And what we also do for the countries is we resource generic brands wherever we can. And it just so happens that this region, you have a lot of access because they're created in India, they're made in Russia, they have a lot of drugs being made in Argentina, and they're being sold over here. So it's easy access for us to be able to go for the generics. And it really greatly reduces the cost of care, sometimes down to 25% less than what you're paying, let's say, in America. Even let's compare Turkey. Homozyme in Turkey is like $360 a month. It's $3,800 in America.
Mm-hmm.
And so that American price is completely off it's never going to happen in the developing world. So that's where our focus is. And Dr. Nassar came in because she took a hold of the big question of how do we implement education? What do we do? And her goal was quality improvement. And this is something the CF Foundation is also involved with. They're doing some international work now. They're trying to support developing world. And in that, they're granting organizations like MECFA and clinicians like SAMIA funds to run quality improvement projects, which are put in place to increase BMI, lung function, and following the hygiene rules in the CF Center, because this is not followed. There's no such thing as segregation. Patients come together and wait outside in the waiting room, sharing bags of chips in the toilet.
And so for anyone that doesn't know, I don't know, this was 30 years ago, but it's been a while. In the United States, you wouldn't be in the same room. You won't even share the same waiting room. You sit in a hallway because of the cross-contamination possibility between lung bacteria and the coughing.
Well, one of the things that happens is our doctors, when we have our conferences, they show slides of their patients, and they're always grouped together, and they know that there are Western doctors in the room. So they make comments like, well, I'm really sorry. I know that this is a picture that doesn't show us following segregation, but all of our patients are hospitalized in one room.
Wow.
sometimes sharing a bed. So we won't bother with trying to show pictures of them segregated.
Mm-hmm.
I mean, these are the things that we go in and we try to, work out. And a lot of it's education, SEMI's had such great results with the Marmor University. We started a program there. It was our pilot and feasibility project, and we called it the MAMI project. So Marmor University and Michigan University. So MAMI.
Wonderful.
And that's a quality improvement education program being run by Dr. Nassar. And there was so many immediate changes. I mean, now when you go to the Marmor Center just outside the clinic for that, you see a table and it's got gloves and, the plastic cover and masks and everything. So people in a trash can so that you can clean yourself before going in and out. They were not following these simple things, even though all those supplies were in the hospital. And Marmor actually is one of the better CF centers in the region. So that quick, go get a table and put some stuff here. She's just walking up and down the halls and saying, don't do this. And you need another room. And you really have to, that was just the beginning. And then came the education, and that's like the research where they're using, patient research on what they're learning and they're implementing to see the changes. And we're studying how that works. And when I really started to say, okay, I know that now, it was so worth the MAMI project and putting it together and all the, overwhelming pressure we had to come up with some idea of how we could begin. And the Marmor University puts all of their patients in the European database. And this year, when Yasmin, the doctor who enters the data into the European database,
mm-hmm.
entered the data, the tech on the other end got back to her and said, there's a lot of mistakes here. The data is skewed. Why is the BMI up so high? And why is the lung function so improved? Something is wrong. And we were discussing it in our last meeting. And I thought, that's it. That's what drives us, there. Look at that. It's so much of a change. They think we're lying.
Because everything worked. They learned and put it in place.
Yeah. And then it just went beyond that. I mean, they're working now with Azerbaijan. Marmor University is working with Azerbaijan CF Center to implement the QI program. They're also working with other hospitals in Istanbul and around Turkey. So it's like this thing that just keeps mushrooming, and organically spreading and growing. And it's a template from MECFA. We're going to copy this program in other countries. We're already planning for 2021. The pandemic, it's just stopped everything. We can't book a flight. We can't, make any real plans. But our hope is in 2021 is that Dr. Uller from the Boston CF Center will be starting the similar project to the MAMI project with the Caritas Baby Hospital in Palestine. So it will be a copycat. Mm-hmm. And then when Palestine is done training, we're going to ask the Caritas Hospital to train in Ethiopia. The goal for us really is to use the American, the doctors and their know-how and create a few training centers in the region. And then we can use those training centers to blossom out and train in other hospitals in our region, but we can keep the resources local because it's costly to bring the American teams over.
Before we started talking, I was going to ask you, do you feel frustrated because the US or England has so much medication and is so fluent with all that is related to CF? But you've already answered my question because what you're doing is changing lives. But I do want to hear how it makes you feel knowing what you know back here in the States and dealing with really you're starting from the beginning. Absolutely starting from the beginning there. Mm-hmm.
Yeah, you're right. Ground zero. Yeah, I call it ground zero when I walk in and there's zero. I have levels. If I see enzymes, I'm happy. I think, okay, I've got to start, so we can build on that, but we have countries where it's just nothing, but I got done. I left the CF community after 14 years from frustration and heartbreak because of that. Because I would go to conferences and there was one thing that used to really irritate me, and I'm over it now because I see so much success now that I feel out of that place where it hurts to look at it, But they show this child from the 1950s as one of the first diagnosed with pancreatic cystic, and before they really knew what CF was. And it's a little boy, and he looks, malnourished and bloated, and it's all the humpback. And they were saying, this is what our patients used to look like, and look at them now. And I'd be like, my patients still look like that. As a matter of fact, that guy looks really healthy. And there was a gap. For a long time, there was a big gap between Western, and understanding or even bothering to look, because you know what the biggest problem that was is the Caucasian disease theory. When CF was first on the radar of clinicians and stuff, it was called a Caucasian disease. It belonged in the white world of the white wealthy world, but that was because they didn't suffer from malnutrition, and they didn't suffer from signs that clinical signs of CF other than by having CF. Whereas in the developing world, you still were suffering from respiratory disorder, from pollution and malnutrition. So it was hard to see the disease the same way. So because for so long over here, Africa, Blacks, and then the brown and Arab people, they were told you don't have CF. So doctors still believe that here.
Which is incredible.
But it's not true. In Turkey, Turkey is Caucasian. So we're on par with Europe on what our ratio is. They have something like 3,500 patients now, I think. So, but in the Middle East, there's still a lot of first cousin marriages. It's cultural, okay? They marry within their tribes, which means there's related. So I had a family in Palestine that had 7 children born and die with CF. Can you imagine?
No, I can't.
And they were first cousins, and their parents were first cousins, and there was like a long line of first intermarriage, So, yeah, I mean, the Middle East, I think the biggest challenge for us is, like I said, diagnostics to prove that we have CF, and it's probably in some countries more prevalent than it is in Europe because of the interfamily marriages. So we have to wait and see what those figures look like years down the road when we have proper diagnostics in place.
How many have you diagnosed in Turkey now, and how many do you anticipate diagnosing with CF?
Okay, well, we're not doing diagnostics in Turkey because Turkey already has their own diagnostics, and they actually have genotyping and everything. Turkey's quite advanced CF care. The only thing they don't have is the modulated drugs, and they are lobbying for
Okay.
them, so it won't be long. And we're equal to New Zealand, and even I think Canada doesn't have them yet. I'm not sure if they do now.
Right.
Yeah, a lot of Western countries that are still negotiating. So, But Turkey has everything that you would find. And you could come here and bring your daughters, and you'd be fine. You'd be comfortable with the care you receive.
So you're talking more about Egypt and
Ethiopia, Sudan, Yemen. I mean, we can't even think about Iraq, Syria, Yemen. I mean, these countries are completely out of our grasp until the political situation changes. A big problem we have actually is Iran. When you have sanctions on Iran, the healthcare systems are affected. And CF patients are now not able to put their German-made nebulizers in their American-made medicine because they're not allowed to sell to them. And why I don't get into the politics of it, but I certainly do deal with how it affects the families. And I will never understand the rationale of it, how CF families are, somehow involved and why it's affecting them.
Mm-hmm.
But yeah, so I find that overwhelming, and I do find it depressing sometimes. At the same time, it's so hopeful. I mean, I just went to in 2019, before the pandemic slammed us all at home, I went to the Nashville North American CF conference, and it's so electric. You can feel you just feel like you're on the precipice of the cure. You just know it's out there. And there's a lot of money going towards it, and a lot of amazing researchers putting their time and effort in it. And the CF Foundation really made it their goal. They're going to find the cure, and I know that they will. And now with the modulator drugs, it's so hopeful. If we can get modulator drugs over here, it just changes everything, because the cost of care goes down so much.
Right.
And also the need and the burden on the hospitals and the clinicians and the allied health is decreased. There's not so many hospital stays. And the patients are able to join their communities and contribute. So they're no longer just a burden on their society and their family.
we didn't meet at the NACFC, but I was there also. And I mean, there's a lot of people there. So Dr. Francis Collins, the director of the National Institute of Health, was there, and he did his singing and uplifted everyone. And he, the true pioneer for CF, and all of our biggest heroes. What did you take away from him? What are your hopes with the future of leaders like Dr. Francis Collins and people like Dr. Nasser and all the doctors that are working toward making the future better for people with CF in the countries that you're working with or even hoping to work in?
Well, what is MECFA? It's a medical association. It's made up of clinicians from the region. And so Dr. Nassar and these clinicians, the pioneers, they're the reason why we do what we do, because they're behind us and they're showing us, walking with us. And sometimes we're carrying them and sometimes they're carrying us, but they all have the same passion. And that passion makes me believe, it's the same thing I felt when I told you, it's euphoric almost, when you work so long in CF and you feel that magic in the air when the doctor is singing to you about all of the trials and tribulations and where we are. And for me, especially thinking of the developing world, I see that and I think, yeah, we're going to get there. Yeah, we will. And I just, the cure, because I would love my job to end tomorrow. I really would. I would love a pill to come and a baby gets diagnosed and he takes a pill or an injection, and that would be wonderful. And then I don't need to go to work anymore. So that's what Dr. Narsar, my hope with Dr. Narsar is she takes away my job.
But it is so hopeful. If you're born today in the United States with CF or, in some other countries that have all these modulators that are available and covered by insurance, I mean, what a time to be born. If you're going to be born with CF is now, because those drugs change the underlying condition of CF, which is fabulous. But we were talking about before we started this podcast, the difference between what we know in the United States and the reality of other countries that don't have the luxuries of the medications that there are in the United States. How do you feel about that? And maybe if you were talking to someone with CF in the United States, I mean, you're not trying to make them feel bad, but it's night and day between CF care.
Yeah, I have to catch myself all the time when I'm with CF patients, because patients sometimes feel sorry for themselves. That's part of having a disease. I have a chronic disease, and I know I feel very sorry for myself when it's active. So it's really hard. I have to catch myself because, of course, I want to say, if you only knew, you wouldn't even be alive right now if you were living in a country that I work in, many of them. You would never have made it past the age of 12, because that's the life expectancy there. Imagine your day without your enzymes. Imagine without a nebulizer. Imagine your day with no medication to clear your lungs. How many days will it take before you can't take a breath without struggling? How many days off your meds will it take? Every time you have a medicine, every time you have an inhalation treatment, be thankful. Be thankful you have it, because life without it is something if you haven't seen it, you haven't walked into a room and witnessed it, you still will never believe it, no matter what I say or how I explain it, because it's drowning in your own sputum and suffering from not being able to digest food and severe pain. So that's their day-to-day life. There's no relief. There's no day when I wake up and I feel better. I said to bite my tongue and say, be thankful. Walk a day over here and see how you feel.
Exactly. That's one of the beauties of doing this. I've learned so much. I think that most of the CF community in other countries have no idea that in other countries they can't get the meds they need. Because I have known that Dr. Nasser's been traveling to Egypt. I've known that for years, but until recently, we've only been able to just start talking about the huge difference that I didn't even realize. everything that she has done and is doing to change everything for others. So extremely eye-opening and so much to learn.
She's about to embark on a QI program. That'll take 4 years. We've put 4 diagnostic machines in 4 hospitals there. So she's going to work in those hospitals now to implement quality improvement. Egypt there's no government support for medication. One, they do have, I think, access to enzymes, but they're buying them and they're costly. I think doctors are fundraising to buy meds. In most of the hospitals, they didn't have diagnostics even. So the government covers care as the regular pediatric care coverage in a socialist system, but the training and things mainly has come from Dr. Nassar going over and training the doctors and raising money to bring them back and forth and do things. But it's been years and there's still very little progress made. So we hope that she can go in and run the education program, and with our work behind with advocating and continuing to push for education, she'll have better success. So, but Egypt's really difficult. It's a ground zero.
What is MECFA doing in the future? Is part of it continuing to raise awareness, but where are you going moving forward?
Well, I said in the beginning, and I keep repeating, this is like our elevator talk: diagnostics, education, CF center team, and center development, and advocating. And we recently just formed we were a year off on this program because the pandemic, and then it didn't fit anymore to put it in place during a pandemic. Okay. There was other things that social media was thinking and people were thinking and doctors were thinking of. So we put it off for a year, but we formed a committee, and one of the persons on that committee is Dr. Preston Campbell, the former CEO of. And we're going to use him. He said, how can, I'm retired, so put me to use him. I said, I know how I'm going to use you. I'm going to send you to all the ministers of health in the countries that we're trying to work, because he has a presence, Preston, and he's very clever and he very passionate. And he's walked the road of the improvements and the steps that have gone on in America to get where you are. So he's, a perfect person for the position. And we're going to send him off to talk to these ministers of health and openly face-to-face advocate on behalf of patients for that short list of drugs we talked about. And, we are going to develop a social media campaign. We're bringing a consultant in to work with us. And that social media campaign will tell a lot of patient stories. We want to awaken the understanding of CF in the region, not just among the clinicians, which is very important, but in the general population. We want CF to be as well known in the Middle East as it is in, America, because even before I was in CF, if somebody would have asked me what's cystic fibrosis, I would have said, isn't that a lung disease? I would have known that because there's just so much information out there in America. So we know what the disease is. We want something like that here, so teachers understand when they have a CF patient and what that means. And people can go for a job interview, even though they have CF and it's accepted in the society. And the things that Americans take for granted are so far off here, So we'll implement the social campaign. And part of that will be a letter that we submit to the Minister of Health, and we collect public signatures on that letter. And we're all hoping that a combination of this and also providing, access to the generic brands, that we'll be able to get some access to the drugs more available over here.
And I have to tell you, I don't know if you know Anas Mansour. He's a dad. His twin boys, Omar and Abdurrahman, have cystic fibrosis. Dr. Fauda is his doctor, and I did a podcast with him as well. He talks about MECFA and traveling to the conference. It is the highlight of his life. He was so glad to get information.
Yeah.
He just couldn't believe all this information and all these doctors. And his story, just one of many, a young professional parent trying to make sure his kids don't die from CF by age 12, as is the statistic there.
Mm-hmm.
He wants to immigrate. He would like to come to the United States or get to the UK. He's so desperate, and you must experience so many of those kinds of stories. But you're definitely the light for a lot of people. as I heard from Anas Mansour.
I know Anas actually very well, and he's a lovely person, and he's afraid. And the overwhelming thing, when you asked that question before, and I read that question when I was preparing, I was like, yeah, it's all overwhelming, hon. Every phone call. I dread sometimes, opening up my IG because I know that there's a message in there that I don't want to read. He sent me videos and things, and it's very hard. And stay positive, keep focused. Don't let your heart rule your mind. That's very hard. I've been told by so many, you're so emotional, you allow it. But if you don't have that empathy, if you don't have that connection, if you don't feel that passion for Anas, or if you don't go away with a tear in your eye, then you're probably not going to be effective at this job either. Because you got to have something that keeps driving you against the wall until you break it. And that wall, it breaks people. It breaks doctors, it breaks families. So I guess you have to. Anas keeps people with those stories. They break my heart, but they also keep me motivated. And I hope we are a light for them. If I have some change, if I can create a better life for even a handful of patients, I'll feel like it's all been worthwhile, of course.
And tell me about those conferences. It's a once yearly when we're not in a pandemic?
It was one of our first projects. And the reason why we went with the conference was because we were trying to build a network of doctors in the region. We have over 250 now. So that's really good for the region. And we're comfortable with that, But we held a conference without really knowing it was going to be annual or what was going to happen, really, just to get people together and introduce MECFA and sort of launch the organization. And we brought people from the US Foundation, and we brought European CF Society people and CF Europe. And it was really fantastic. We had over 330 delegates, which again, it's a rare disease in the Middle East. And there are no organizations dealing with there are no really nonprofits over here. They just don't operate the same way over here. All the care is covered by the government. So you don't need a lot of charities working to, improve care. So it was really wonderful to see so many people, and there were families also came, and the doctors, clinicians from all over the region. And so we decided, okay, let's have an annual conference. And so the next one we held in Izmir, Turkey, my city, and the one after that was in Istanbul. And our topics, are basic because our clinicians are not as advanced as clinicians. It certainly doesn't look like the agenda you see at the North American or the European conference. But we find that what is really valuable in the conference is the networking opportunity. And for someone like Anas to come and say, oh, look, there's doctors that care about CF in the Middle East. I didn't know that. But it's also an opportunity for clinicians to meet up and share and talk. We always make sure there's plenty of time for every country to have a clinician to deliver a 15 or 20-minute talk about CF in their country. So it's an awakening. And I really am always surprised by the Western doctors who come who are just like, oh, I didn't realize it was quite that bad or quite that good. So I learned a lot. So I think the conferences are important for our region and also for the international CF clinicians to learn.
And what have you found that maybe is something that you need to grow or work on to move forward to kind of expand what you're doing?
It's always funding. Funding is such a problem for organizations because education programs cost money, and even discounted diagnostic equipment costs money. Running an advocacy campaign costs money. And so funding is a barrier always. And we're very fortunate that the CF Foundation has been so very generous. And every project that we've put across their table, they've agreed to support. So that's been wonderful. We do get pharmaceutical support, but we're very careful even with pharmaceutical support because in this region, there's still a lot of loose laws around pharma and how they work with clinicians. And a lot of pharma, not the ones that we work with in CF, but they will give holidays for prescribing drugs. And there's a lot of, not so good situations, let's say. So our doctors become, they don't want to deal with the pharmaceutical company. They don't want to take money from them because they don't want to have any, have the pharmaceutical companies have any say over what the programs are. So it's funding. And then the other barrier is continuing to connect with the right clinicians. Because you can go into a country and you can say, okay, I'll give you diagnostic equipment and I'm going to come and visit you with the American people. And they're like, oh, I'm so excited. Yes, yes, I want everything. But they're not actually doing anything. They're very busy. It's just, they're really not the right contact. They don't know what to do because you have to be kind of a special clinician. You have to have contact with the Ministry of Health and you have to be really dedicated and focused on CF. And that can be hard to find. So I think those are the two biggest barriers that we have for future. And where are we going? You had asked me, where are we going in the future? We're going to continue to run the quality improvement, repeat the quality improvement projects until we have training centers across the region. We're going to continue to donate diagnostics and continue running advocacy in the area, in the region, and building awareness. So that's really our main focus.
Because of everything you're doing, I wonder at what point life expectancy will change. Would you imagine at what point? Is it years away, or when will it go from 12 to hopefully into adulthood? Are you able to even guess at this point?
I think a doctor would, and I can, and I will, but I'm not a clinician, so I want to, don't. I think it would be better answered by a clinician. But what do I see with the MAMRA project? I told you, we had the BMI increase so dramatically that the tech's calling back saying you made a mistake entering your data. So if that is what the results are going to be, then I see adulthood very quickly coming. Okay, I feel like we will raise that age very quickly because look how fast things moved in MAMRA. The program was only underway a year and they had that kind of a change. So if you can implement that program in another center and you have that same results, you can see that very rapidly you're going to be looking at adulthood. We are also including, the transition. That's where Ahmed is coming in. He's going to be very helpful. It will help us to have an adult CF QI program and help with the transition from pediatric to adult care. And we haven't had to think about that before because it was just always so far back. We thought, oh, well, we don't have to worry about that for another maybe 10 years. But now we say, look, we better add that because it's coming. So I'm very hopeful and positive about that.
That is so exciting. I remember adults here saying that they were, so excited because they believed that they were going to live into adulthood when that was happening in the United States.
Yeah, and now they're going to live to be old people. The former president of CF Worldwide, he's in his 60s, Mitch Messer. He's lovely. He's still going strong, and I'm so happy for him. But his brother died at in his teens. I want to say 16. It might have, I don't know exact on that, and the reason is he just wouldn't adhere to his treatment the same way. That's what Mitch felt it was. He didn't do his physio. He didn't take his vitamin. He didn't do the things he was supposed to do. So
as we wrap up this podcast, is there any message that you want to get out to everyone as far as where you're going or what your hopes are? But I think everything you're doing is so exciting, and I'm so glad that you educated us as far as what the needs are and where you're going.
Well, I guess if I'm speaking, directly to an American CF audience, I would just say, if you have time and you can volunteer or you can donate a small amount to a program internationally, not just MECFA, okay, this is the Middle East, but there are programs going on in Latin America. There are programs going on in Africa, maybe where your heart is or you feel a connection, to look at how you can support those programs to continue and to remember and to know how it is in the developing world and where CF patients are, and don't forget them. And as you celebrate all of the great advances and your access to all the wonderful care and the new modulators, and just save a place somewhere in your heart and mind for those patients who are still many, many, many years behind. And volunteer, donate, give time, give resources, add your skills, join a board, do what you can to help.
Christine Noke, Middle East CF Association, thank you so much for talking to us on this podcast. Would it be helpful to say how the mindset of any parents has changed since you've implemented MECFA in areas and given them more hope? Is there any point in mentioning that?
Well, I will tell you a little story, and you can pin it, tag this in if you want. The Marmara Project, okay, what they had the hygiene education that they were teaching in the center, Dr. Nasser was teaching. And so the Marmara team immediately connected with KIFTR, which is the CF Association, the family association here in Turkey. And it's a very strong organization, and it's headed up by Ilknur, a mother of CF, of course. Mothers are always the warriors, and dads too. So they teamed up from this program, and they created a manual for patients to follow hygiene rules when visiting the clinic, meaning put a mask on before you go, don't sit together with patients, schedule your appointments so that the clinician knows when you're coming, because in socialist healthcare, people just go to the hospital when they want. There's no appointment. You just show up and go to the department you want and you get seen. Sometimes you wait, sometimes you don't.
Interesting.
Yeah, so the families got together and made this manual. And so the doctors told me, it was funny, yes, now the families, the parents, understand the CF standards of hygiene in the center, in the CF center. So when they see something wrong, they reprimand the doctors.
Beautiful.
You didn't change your gloves. You didn't change your mask. You shouldn't be in here without your new mask on. So they're doing those kind of things. So bravo. Parents want to do better. They want to know, and they want to see how what can they do to make, not every parent, of course, you have different scenarios, but for the most part. So anytime you can offer parents anything like Anas from Egypt or anywhere, they feel so thankful and grateful. And they are the first to speak out and say, thank you, MECFA. Thank you for focusing and for pulling the clinicians together and for bringing change to the region. And it gives them hope.
And that's wonderful that they're kind of cross-checking each other on the precautions. And that is wonderful. Again, Christine Noke, founder, CEO, president, extraordinary woman working on MECFA and changing the world. Thank you for joining us.
Thank you so much. It's just such an honor to be here with you, Laura. And good luck with your daughters, and take care and stay safe.
Thank you.
The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, check them out online at thebonnellfoundation.org. That's BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, the science of possibility, and produced by Jag and Detroit Podcasts.